Hello, my name is Lindsay Vanderlyn, and I'm just going to be talking about public health and the services that it provides to individuals and the community. I'm going to walk through the 10-step cycle or 10-step process of the public health care system and just how it serves the community in 10 different ways. So, the first two steps of the little 10-step cycle would be monitoring and diagnosing, and this is like just monitoring the community and identifying the problems that are solvable in the community, and then investigating those problems and figuring out sort of a plan. And like examples of these problems could just be like a recall in the food industry or motorcycle accidents, teen pregnancy, just like things that are common throughout the community that are also issues. The third and fourth steps in the 10-step process would be informing and educating the public about these health issues. So that could mean like going into schools, posting newspaper articles, just general awareness. And then the fourth step is mobilizing the community partnerships and just developing an action plan to solve these issues. So community partnerships could be like local news stations, the schools that you're going into, just really getting the community involved to get that information out there. The fifth and sixth step would be just developing policies and laws, and then the sixth step is just enforcing these laws that protect health and ensure safety. This would just be getting the government involved, which is just also getting law enforcement involved, just making sure everyone's on board in following through with this plan. The seventh step in the process is finding the people that need these personal healthcare services or that are affected by this healthcare problem and ensure that they get healthcare. This involves step 8, which is just making sure that there are competent and personal healthcare workers involved. These two steps just kind of go in tandem with each other, but it's just making sure that the people that need the healthcare get access to the healthcare in some way, whether it be through nonprofit organizations, whether it be through the formal healthcare system, whatever that may take. It's just making sure that everyone that needs healthcare gets it. And then the last two steps are just evaluating the effectiveness of the process, just making sure are the right people getting in contact with the right people? Is everyone getting access to healthcare? Is the healthcare problem actually decreasing, just getting better? And then the last step is just researching new ways for the health problems, just making sure that this problem doesn't keep happening in the future as frequently, just evaluating the whole system and improving it, which they're always doing with everything. So basically that long 10-step process can be just summed up in 4 words, I guess: assessment, policy development, and assurance. Just assessing the problem, developing the correct policies and procedures to fix that problem, and then assuring that this problem doesn't keep happening in the future. I personally think that this system is very valuable to public health. Just based on the past, looking at the past and the present alone, I feel like there's been such an improvement in knowledge. The general public knows a lot more about the consequences of their actions, the consequences of smoking, for example. Just they know a lot more about nutrition now. There's just so much more education available, and more public health concepts are being taught in elementary schools, middle schools. Just there's an overall increase in education, and that alone is helping decrease public health issues. There's always room for improvement. I feel like that's what step 9 and 10 were, just evaluating and assessing, is there things that we still can do to improve? And of course there is, but I definitely think that the value of the public health system is getting better. Access to healthcare is still an issue. It's always changing with the new party in office, but I think that people are definitely more aware of the issues of the public healthcare system, and we're putting steps in place to make sure that more people are getting insured, more people are getting access to healthcare that they deserve, no matter what their income is. So I think as a country, we are definitely improving, and this 10-step model is a great place to start.